Okay, let's talk about horseshoe kidney. Horseshoe kidney. Horseshoe kidney, you can see it in the picture. You have the horseshoe type kidney, right? So it is an inferior pole of both kidneys fuse abnormally. So inferior poles are fusing abnormally as they ascend. They're going up from the pelvis during fetal development. Horseshoe kidney gets trapped under the IMA, inferior mesenteric artery, and remains low in the abdomen. Kidneys can function normal because it's normal, but associated with hydronephrosis. But hydronephrosis can occur. Example, uretero-pelvic junction obstruction, UPJ obstruction. Renal stones can occur, infection can occur, increased risk of renal cancer. Higher incidence in chromosomal aneuploidy like Turner syndrome, trisomies 13, 18, and 21. So trisomies and Turner syndrome. So what is the thing that the kidneys are going to function normal, but there's a higher chance, or it is associated with hydronephrosis, renal stones, infection, and renal cancer. Looking at this CT scan here, you have this horseshoe kidney. You have the kidney all the way, goes all the way. That's a horseshoe kidney. Okay. And let's see what so the important point here is that, let me change color. So the 12th rib, 12th is the floating rib. It lies medially to the parietal pleura and distal to the kidney. So let me actually draw that. Let's say this is the 12th rib. It lies medially it lies to the parietal pleura, and distally it lies to the kidney. And that's the 12th rib. Okay, so now if you have a distal fracture of this, you have a fracture of 12th rib at distal site. That fractured distal 12th rib can lacerate, can go straight into the kidney. Lacerate into the kidney, especially on the left side, because the left kidney lies immediately deep to 12th rib. So they're saying if you have a 12th rib, it can go easily and lacerate the left side because that lies a little lower than the right side, and it lies directly behind that 12th rib, 12th floating rib, right? And if you have horseshoe kidney now, you already had the left side low. Now you have way lower than that. Okay, that's one thing. Second thing, when they say that it's associated with renal cancer, which cancers? If you're in children, we are looking at Wilms tumor. And if in adults, we're looking for RCC, renal cell cancer. Okay. And now fusion, we said, is the isthmus, right? Now, if we go with the embryology, which structure are we talking about in fusion? Or are we talking about fusion of metanephros, mesonephros, pronephros? Right? And that's simple to think, but it's hard if you don't know it. So the answer to that is there's a fusion of metanephric blastema. Metanephric in metanephros, we have the metanephric blastema and the ureteric bud. So here we are talking about fusion of metanephric blastema. Okay, so that's all we have for the horseshoe kidney.